Well, when we talk about the health aspects of or the health impacts of Islamophobia, you mentioned a great example of women from the because of the Muslim ban, women from those countries having preterm births. What could you give like a? I know there are probably like so many different kinds of impacts, but could you give the listeners some kind of idea of like other health impacts as well?
Yeah, so we have quite a bit of work in the mental health space about the impacts on mental health. So everything from depression to anxiety to psychological distress and things like that, to even issues with like identity formation and internalizing stereotyping that we see connected to mental health issues as well. So a lot of work, or a growing body of work, has been done on the mental health impacts. On the physical health impacts, we have a little bit less information, which people are always sort of more hungry for. Like we see some evidence of impacts on heart disease and hypertension, some evidence of impact on chronic conditions like diabetes, and then a lot of impacts on health behaviors. Like if you experience discrimination or racism, you're less inclined to engage in like healthy health behaviors and healthcare seeking behaviors. So going to the doctor, getting advanced health screenings, accessing healthcare, feeling comfortable with your physician, like those types of things. So when I talk about health impacts, I'm referring to collectively all of those things: mental, physical health, health behaviors, and healthcare access and utilization.
Have you looked into do you have any data on vaccination and the Muslim community or the immigrant communities? Like, does that affect? Because I feel like there's different levels of paranoia about vaccinations. Do you think there's something specific to this to these demographics?
I would love that data. If you have that data, please give it to me. There's a lot of speculation that, and I've seen, quite a bit of talk, not quite a bit, a little bit of talk about how, because we do not have the racial and ethnic data again on these communities, that we don't know anything about vaccination rates and vaccination uptake. And again, this is why that race ethnicity data is really important, because the Muslim community, the Arab community, the Iranian community, these communities are not the targets for vaccination programs and uptake. And so we could be missing a whole segment of the population that is not vaccinated or under vaccinated and has vaccine hesitancy, and we have no targeted programming because we frankly don't know anything about their vaccination rates. And so it shows exactly why this is a problem.
So they're just kind of slipping under the radar.
Yep.
Oh.
Exactly.